and I'm going to be your nurse today. Can I first have you confirm your name and your date of birth? Okay, Mary, hello, nice to meet you. So I just want to go over what we're going to be doing today. We're going to change your wound dressing. I'm going to collect a culture from that, and then I'm just going to go ahead and re-wrap it back up using Sterile. Before we get started, can you tell me if you're in any pain on a scale of 0 to 10? 0? Okay, perfect. I'm going to have to put on PPE for this procedure, so give me just a minute to get ready. Okay, so to don PPE, the first thing I would do is put on my gown. And then I will put on my mask. Oops. And my goggles. And gloves. And I'm going to grab my bandage scissors and use this to cut off her wound dressing. And I'm just going to move the garbage can right in front of me so that you can throw a couple things away. So we're going to cut through this. Okay. Set this to the side. And then as I'm checking out her wound before I start cleaning it or getting the sterile field ready or anything, I'm just noticing if there's any odor, any discoloration, and everything looks normal. So I'm going to go ahead and start with prepping the sterile field. Actually, I want to just place this sheet below her wounded side. Okay, now I'll go ahead and take off my gloves. Okay, so here is my tray for my sterile field and my culture that I'm going to have an assistant help me with. Okay, and then I'd perform hand hygiene with hand sanitizer. I'm just going to put hand sanitizer. Open this up, place that in the trash, and I'm going to put on my first pair of sterile gloves. Making sure to only touch the outer 1 inch of my packaging. Okay. And now the second pair. Okay, I'm going to throw that away. Take my biohazard bag, place this to the side of the patient to discard all of the gauze that I'll be using to clean the wound. And then I'm going to set up my sterile field. Okay. My ABD pad, my second pair of sterile gloves. I'll be using this to measure the wound and the depth of the wound. to clean and pack. And my tape. And then I'll be pouring with the label facing my palm. Okay, so first we'll begin with cleaning. So I will soak one piece of gauze. And as I'm cleaning, I'm just going to go in one stroke per piece of gauze. Throw that in the biohazard bag. Another piece of gauze. And I'll go down the other side, put that in the trash. This is a new piece of gauze. Cleaning down the middle this last time. And then pushing this in the biohazard bag again. But this is a new piece of gauze now. Okay. So the next thing I'm going to do is measure my wound. So I'm going to have my assistant help me out with grabbing the culture swab for me. Okay. We're just going to kind of roll this around in here. And then from the wound's deepest point, I'm going to measure the depth. And it looks like it is 2 centimeters deep. So I'm going to give that back to my assistant and she will take that off to the lab. And then I'm going to measure the wound. And the length of the wound looks like it is 9 centimeters. And the width looks like it is 8 centimeters. So I'm going to dispose of that in my biohazard bag. And then I'm going to palpate the outer edges of the wound. Here I'm just ensuring there's blanching, noticing any edema, the temperature, the color. And it looks like it's healing appropriately. So I'm going to go ahead and change my first pair of sterile gloves. And then I'll perform hand hygiene, putting hand sanitizer. And I'm going to put on my second pair of sterile gloves. And I'm going to do this on the patient. Is that okay with you, Mary? Okay. And again, just making sure to only touch that outer inch. And I will throw this in the garbage. Okay, so now we just need to pack the wound. So getting this gauze wet again. And then I'm making sure that the gauze does not touch the healthy portion of the skin, only inside of the wound. And I don't want to pack it too high above the surface of the skin. So it looks like that would be good right there. I would take another dry piece of gauze and place that on top of the wound. And then I'd place my ABD pad. And I would take that. Okay, and then lastly, I'm going to go ahead and wrap the wound in gauze. Okay, Mary, how does everything feel? Any pain or anything? Okay, great. And then as I'm wrapping it, I'm just making sure to not keep it too tight, but close enough to the wound to make sure everything's in place. Going to tape it off down here. And then I am going to label it. So there's my label. And now I'm just going to clean up my area. I'm going to take off my gloves to doff my PPE. Before I do that, I will remove this pad. Put it in biohazard as well. So to take off my PPE, the first thing I'll take off is my gloves. And then I will take off my gown. And then my goggles and my mask. And then I'm going to initial and write the date. Okay, and then I'm going to perform hand hygiene once more. Okay, Mary, so we got that culture taken. I was able to change your wound out, or your wound dressing out and get it cleaned up. Is there anything else I can do for you while I'm here? Okay, well, go ahead and just hit your call light if anything else comes up, and I'll be back to help you.